There is this question I keep getting about, nurse, can I get pregnant with blocked tube? This is a question that I normally receive all the time. So this is the reason why I decided to make a video to answer every of the question. For a natural conception to happen, there is 5 requirements that a woman needs to consider. Number one is the sperm must be in a good quality and a good quantity. Secondly, the woman must know her fertile period. I have made video about knowing your fertile period, even knowing your ovulation day is very important as a woman so that you can able to know when you can meet your partner so that you can get pregnant. Another requirement is that the woman's body, especially the womb, must be conducive to carry pregnancy till 9 months. That means there should not be any fibroid or any endometritis so that when the fetus implant in the uterus, there will be no hindrance of the child growing. The fourth one is that the fallopian tube needs to be open so that the sperm can travel through and meet the egg so that fertilization can happen. So that the egg after fertilization can also travel from the fallopian tube to the uterus where the fetus will develop till term. If the fallopian tube is blocked, there is no way the egg will travel from the fallopian tube to the uterus or the sperm traveling to meet the egg in the fallopian tube. The fifth one is that the woman must be able to provide quality egg from the ovaries, have quality egg for fertilization to take place. This is the 5 quality for a natural conception. If you are watching this video for the first time, this is Health Matters with Nurse Mercy, where we talk about health related topic because health is wealth. So stay tuned and watch this video to the end. Blocked fallopian tube is the major causes of infertility. A lot of women may not know that they have blocked tube. This could result to them having difficulty in having a baby. So I want to explain about the causes, the symptoms, and what you need to do for you to know if you have blocked tube or not. So the function of the fallopian tube is that when a woman release an egg, the egg travel to the fallopian tube waiting for the sperm to fertilize the egg, and the sperm will also swim traveling from the V of the woman down to the fallopian tube so that this sperm can meet the egg and be fertilized. So when the fallopian tube is blocked, the egg coming from here cannot pass through, and the sperm coming from here cannot pass through to meet the egg. So this is the reason why there is a lot of infertility because of blocked tube. One tube can be blocked, the other tube may not be blocked. So there are so many causes of blocked tube. So let's discuss what will be the cause of this blocked tube. Number one cause is PID, pelvic inflammatory disease. This could be sexual transmitted infection that can result in blocked tube. So the infection may be chlamydia, gonorrhea. That is the reason why we recommend protected intercourse for you not to have this PID. This sexual transmitted infection can travel to the fallopian tube and block the fallopian tube. So this is one of the causes of blocked fallopian tube. Another causes could be uterine infection. Uterine means the uterus. Uterine infection, it may be that unsafe abortion or unsafe miscarriage. So another cause of blocked tube is abdominal surgery, such as fibroid. This can result to blocked tube. Another cause of blocked tube is endometritis, previous ectopic pregnancy, then fibroid, depending on the position of where this fibroid is located. If the fibroid is pressing the tube, This can lead to tubal blockage. Another causes could be tubal surgery. It's when the tube is blocked. For this surgery to make things get better, it makes things worse if it's not done in a proper way. So it can result to tube blockage. So we have various types of tube blockage, and this type depends on where the blockage is being located. If the blockage is close to the uterus, it's called proximal block. If the blockage is in the middle of the fallopian tube, it's called mid-segment block. If the blockage is at the end of the fallopian tube, it's called distal block. And if the block is at those fingerline projection at the end of the fallopian tube, is called fimbrial block. We have another blockage called hydrocypin. Hydrocypin means accumulation of water. Could be that the fallopian tube is filled with water. This can result to blocked fallopian tube. So what could be the signs of blocked tube? There is no obvious signs of blocked tube. That is the reason why most people don't know that they have blocked tube. But this blocked tube can be diagnosed if the woman walk into the hospital complaining that she have infertility, and some diagnosis scan will be carried out to show if there is any blocked tube. If the blocked tube is associated with hydrocypin, accumulation of fluid in the fallopian tube, the fluid can drop or flows down into the fallopian tube, and the woman will start having discharges and also irregular menstruation. How is this blocked fallopian tube being diagnosed? A detailed history will be carried out by the doctor, asking the woman, have you had any ectopic pregnancy, any miscarriage? Did you have any sexual transmitted infection previously? Did you have any fibroid? Was there any operation carried out, and how was it done? Another diagnosis that could help to detect if there's any blocked tube is HSG, hysterosalpingogram. It's when a dye is injected into the woman's body, and this dye will travel into the fallopian tube. An X-ray is done to show the movement of how the dye is being traveled. And if the dye flows out through the fallopian tube, it shows that the fallopian tube is not blocked. And if the dye did not flow out in one of the tube, it will show that one of the tube is blocked. The common question some people ask is that, can I get pregnant in just one tube? The simple answer is yes. If one of the tube is blocked, the other tube is open, so she can get pregnant with one of the other two. If you are having difficulties to conceive, probably you may not know that you have blocked tube, please you can see a doctor so that there will be an immediate treatment. Yes, there is a treatment in which to treat blocked tube. So see your doctor and know the right thing to do so that you can conceive naturally. Is this video helpful? Please follow, share to people for others to learn. Don't just learn alone, and follow for more health related topics. Thank you so much for watching, and see you in my next video. Bye bye.